This is CCTA case number 40. The history is that of an 82-year-old man who's had a history of a heart murmur and cardiac valve disease. He is now status post surgical correction. Let's start looking at this patient. This is a 10-phase study intended to look at cardiac function, left ventricle, right ventricle. Let's move up to the area of the aortic valve. You can see here that there has been an intervention, so I'm going to rotate around to that area, get a little bit better idea of the distribution, move around a little bit to try to see this valve a little bit better. Now I can then try to get this in a straight en face view and look at function. You can see that this motion, there's some struts here that signify some type of aortic valve surgery, aortic valve replacement. But if we can get this in a little bit better view and switch from a 5mm up to an MPR view, we can start going up and down and see that there are 3 distinct struts here, and that we can see that the opening of the valve is right here. Now let's see if we step through the motion to see if we can get this to its greatest excursion. We can see actually now that there are 3 little leaflets. This is a bioprosthetic valve, could be either porcine or bovine, but there are 3 valve leaflets here and then the mechanism that supports that. We can get a general idea of the overall size of that by basically measuring the opening of the valve. We're getting about 20 millimeters, 21 millimeters. This is a relatively tight valve. It's not a native valve. It's small. And this patient has had aortic stenosis, and what they've done is replaced with a bioprosthetic valve. Let's see if we can get a better idea by then trying to look at this function in a dynamic view. You can see that all 3 cusps are opening widely. There is no evidence for restriction of the opening of this. So he's had aortic valve replacement. Take a look at his mitral valve as we're already here. Let's try and get this into a general view. We can see the mitral valve here. We're in a MPR view. Let's take a look at function and motion. You can see excellent motion of the anterior leaflet of the mitral valve and the posterior leaflet. So there's no evidence for any mitral valve disease. This is an aortic valve replacement. Let's take a look at a 3-dimensional view here. We can see the sternum. One of the interesting things here, this patient has had an aortic valve replacement, but I see no evidence for a median sternotomy. This patient, in fact, has had a minimally invasive approach, which goes from the suprasternal notch, which is not included in this area, to put in this bioprosthesis. So it's a minimally invasive surgery. Let's take a little better look at this by trying to do some sculpting of the region. I'm going to do a positive region sculpting here. Now let's take another look at the region of the aortic valve. We can cine this and again see motion of the aortic root. But let's stop this for a second. I'm going to do what's called a half space, which is basically down here. I'm going to go halfway through the region and then try to look at cardiac function. So this patient has had a minimally invasive aortic valve replacement with a bioprosthesis that appears to be functioning normally, although is quite small, on the order of 20 to 22 millimeters. his overall cardiac function is normal, and his mitral valve function is likewise normal.